I'm going to start by asking Dr. Regina Cunningham, who's the Chief Nursing Officer here at the Cancer Institute of New Jersey, to talk about the physical challenges in cancer survivorship. And so if you'll kick us off, Regina.
Sure, great. Hello, everyone. It's my pleasure to be here. Just want to start with a bit of background, as we've heard a little bit from Barbara. This issue is a really sort of front and center issue in the healthcare arena now. We know that at last count, over 11 million cancer survivors in the U.S., and that number is expected to double over the next couple of decades, so that's really good news. Certainly, these improvements are related to better detection, earlier diagnosis, which may be a result of good public education, better therapeutic efficacy, and better supportive care, as Barbara mentioned, so that we can give more aggressive treatment so that it can really have improved lifespan. So while these have really enhanced overall survival, many of these treatments are not without untoward effects that can occur well after the cancer treatment has completed. So I want to talk a little bit about what some of these physical effects are. So, patients can often experience lingering side effects or late effects of treatment, as I mentioned, long after they've completed therapy. And these can affect the quality of their life. So they're important to know about. The big issue about understanding the late effects of treatment, physical effects, is that we need to understand who is at risk for these types of complications, and we need to provide very specific risk-based care. So it's important for us to understand the issues. So one of the issues that compounds this or makes it more difficult is that as cancer treatments have changed over time, the types of toxicities that people experience long-term have also changed. So it's kind of a moving target. It makes it quite difficult for us to predict. And to be very honest with you, we don't have a good enough understanding of this, as Barbara mentioned in the beginning. And we don't because we have historically not paid as much attention to this issue as we really need to. The big issue historically was, okay, let's just get the patient treated as aggressively as we possibly can. Let's just increase survival. But the quality of that survival has not always been something that we have been focused on, with the exception of the pediatric population, where we've seen higher rates of survival and have done more research. So we can learn a lot from our colleagues in pediatrics. We do really need to address these issues in much more depth in the adult population. So let me tell you a few things about what we do know. And again, these are important physical effects that we have identified in patients who've received different types of cancer treatment. So one very important issue is that we know that patients who undergo cancer treatment can have longer-term problems with their heart or with their pulmonary function. So chemotherapy can cause cardiovascular toxicity, several different types of cardiovascular toxicity. So Donna Lynn mentioned that she received the drug adriamycin. That's a drug in a class that we called anthracyclines. And those drugs can have effect on cardiac function once you reach a certain dose. And so that's important for us to know because we want to monitor patients long-term for any kinds of cardiac effects related to that. A newer drug that's used in certain types of breast cancer called trastuzumab, or the trade name is Herceptin. That's a new biological therapy that's given to women with certain types of breast cancer. That can also cause problems long-term with cardiac function, but those problems are different than the types of cardiac problems that are caused by the anthracycline drugs. So the thing is that we often give those drugs in combination. So again, identifying what those problems are long-term and making sure that we have effective monitoring strategies is very, very important because obviously that would be a big challenge for people. So we really need to identify who are the high-risk patients and what are the optimal screening strategies over time so that we can assure that we're providing the right risk-based care. So testicular cancer is another example. It's one of the most common cancers among young men, and one of the reasons the survival rate is quite high. It's really improved over the years as we've given combination chemotherapy. One of the fundamental sort of cornerstones for therapy of men with testicular cancer is a drug called cisplatin. So this drug can also cause a number of different cardiac effects. So and that's important because, again, testicular survivors are surviving for very, very long periods of time. So understanding understanding the mechanisms of those types of toxicities is also very, very important. So what we've noticed in long-term survivors of men with testicular cancer is that they have an increased risk of cardiovascular disease. They tend to have greater obesity, greater lipid levels, triglyceride levels, and other risk factors when compared to people who do not have a history of testicular cancer. So again, very, very important for us to understand those physical effects. Pulmonary effects can also be caused by different types of chemotherapy that's toxic to the lungs, as well as radiation therapy. One important thing is that many patients receive what we call multimodality therapy, more than one type of therapy. So we often don't just treat patients with surgery or just with radiation or just with chemotherapy. We often use combinations of those things. And that increases, the complexity of what we're looking at in terms of the physical effects down the road. And this can be affected. This can also be seen in patients receiving stem cell transplant, bone marrow transplant, where we're giving very aggressive therapies. We also know that there are a number of reproductive issues. Treatment with radiation or chemotherapy can have adverse effects on germ cell survival, fertility, and the offspring, and the health of offspring. Loss of ovarian function following chemotherapy can also be associated with changes in libido and sexual function. So I love Barbara's myth about dispelling that. So we just need to really understand sort of some of the physical mechanisms behind that. So again, we can address who's at risk. Osteoporosis is another big issue. So that we have a better understanding of. There's been more research in that area, but making sure that we're monitoring for that and preventing any risk for fracture, things of that nature is important. Physical functioning can be an issue. I'm delighted to hear Donna Lynn's story about her ability to increase physical function. That's an issue that we often hear from survivors. So decrease in physical functioning, basic body mobility, and ability to engage in work activities and in leisure activities. So those can obviously have a huge effect on quality of life. This can occur across cancer diagnosis. So it's not particularly associated with one type of cancer or another. And in some patients, we see that for several years after. We did a study recently in our breast cancer survivors, and we found that about 50% experience long-term fatigue. So that's a very big issue, and we need to understand that better. So it's an area for research. Lots of other physical effects that we can see. Again, these are very specific to the type of therapy that you receive. Surgical intervention, for example, in breast cancer patients can result in problems with numbness, pain, loss of range of motion. Lymphedema is a common problem that we see. Chemotherapy, problems with cognitive function, menopausal symptoms may occur as well. Another issue that we really worry about a lot is the development of secondary cancers, because sometimes cancer treatment in and of itself can cause alterations that will lead to secondary malignancy. So that's actually a very active area of research. So basically, there's a number of different types of challenges. I think our role, our call to action is to really understand what those are all about and to begin to help to describe them better and to think about the interventions that will prevent or ameliorate them. Again, identifying those patients who are at highest risk and providing early intervention. That's why we need to know about these things so that we can provide the kinds of services and education that are really required for these patients. So I think that in order to enhance quality of life long term, we need to really understand what's going on with the physical effects. There's a lot of multidisciplinary research. This is going to take a lot of people doing research because it has many, many diverse aspects. We really need to characterize these lingering physical effects and to develop the tailored interventions that are based on individual survivors' particular risk. So there's a lot of work to be done. A call to action is for us to broaden our understanding, for many of you in the audience to perhaps participate in some of the clinical trials that are going to be ongoing, looking at these issues long term. Thank you.
Thank you.